Diphtheria was first described in the 5th century BCE by Hippocrates, the ancient Greek physician. However, the causative agent of diphtheria, the bacterium Corynebacterium diphtheriae, was not discovered until much later. In 1883, German physician Edwin Klebs first identified the bacterium in diphtheria patients, and in 1884, his student Friedrich Loeffler confirmed its role as the cause of the disease. This discovery eventually led to the development of effective treatments and vaccines against diphtheria. Diphtheria is an infectious disease caused by the bacterium Corynebacterium diphtheriae. The infection primarily affects the upper respiratory tract, including the throat and tonsils, but can also affect the skin in some cases. The primary route of diphtheria infection is through respiratory droplets. When an infected person coughs or sneezes, they release tiny droplets containing the bacteria into the air. These droplets can then be inhaled by nearby individuals, leading to infection. Diphtheria can also be spread through close contact with an infected person or by touching contaminated objects, such as toys, clothing, or personal items. In some cases, diphtheria can also be transmitted through contact with infected skin lesions or wounds, especially in individuals with cutaneous, skin, diphtheria. This form of transmission is less common than respiratory transmission but can still lead to infection. Vaccination with the diphtheria tetanus pertussis, DTP, or diphtheria tetanus acellular pertussis, DTAP, vaccine is crucial for preventing diphtheria infection. These vaccines are part of routine childhood immunization programs in many countries, and they have significantly reduced the incidence of diphtheria worldwide. Diphtheria is a bacterial infection caused by Corynebacterium diphtheriae, which primarily affects the upper respiratory tract. Symptoms of diphtheria can vary, ranging from mild to severe. They typically begin to appear within 2 to 5 days after infection. Common symptoms of diphtheria include sore throat. Diphtheria often starts with a sore throat, which can be mild to severe. Swollen glands. The lymph nodes in the neck may become swollen and tender. Fever. A mild to moderate fever may accompany the infection. Weakness and fatigue. Infected individuals may experience general weakness, tiredness, and malaise. Difficulty swallowing. As the infection progresses, it can become increasingly difficult to swallow due to throat pain and swelling. Nasal discharge. A runny or bloody nasal discharge may be present. Hoarseness or loss of voice. Vocal changes may occur as the infection affects the throat and vocal cords. One of the most characteristic symptoms of diphtheria is the formation of a thick, grayish-white pseudomembrane over the throat and tonsils. This pseudomembrane is composed of dead cells, bacteria, and other substances, and it can obstruct the airway, leading to breathing difficulties. In severe cases, diphtheria can cause complications such as airway obstruction, difficulty breathing, heart problems, nerve damage, and kidney damage. These complications can be life-threatening, making early diagnosis and treatment crucial. It's important to note that there is also a cutaneous, skin, form of diphtheria that primarily affects the skin. Symptoms of cutaneous diphtheria include non-healing skin ulcers or lesions with a grayish-white membrane. If you suspect diphtheria or are experiencing any of these symptoms, it's essential to seek medical attention promptly. Diphtheria can be successfully treated with antibiotics if caught early, and vaccination is highly effective in preventing the disease. Diphtheria is a serious bacterial infection, and timely treatment is crucial to prevent severe complications or even death. The primary treatments for diphtheria include antitoxin. The first line of treatment for diphtheria is the administration of a diphtheria antitoxin. This antitoxin neutralizes the toxin produced by Corynebacterium diphtheriae, which is responsible for the damage caused by the infection. The antitoxin is usually given intravenously or intramuscularly and should be administered as soon as possible after a presumptive diagnosis has been made. Antibiotics. In addition to the antitoxin, antibiotics are used to kill the bacteria and prevent further toxin production. The most common antibiotics used for treating diphtheria are penicillin and erythromycin. The choice of antibiotic may depend on the patient's medical history and potential allergies. Supportive care. Patients with diphtheria may require additional supportive care, such as pain relief for a sore throat, fever reduction, and maintaining hydration. In severe cases, hospitalization may be necessary to monitor the patient's condition and provide appropriate care. Airway management. In some cases, diphtheria can cause significant airway obstruction due to the pseudomembrane that forms in the throat. If the patient has difficulty breathing, they may require airway management, such as the insertion of a breathing tube or a tracheostomy. Isolation. Diphtheria is contagious, so it's important to isolate infected individuals to prevent the spread of the infection to others. Proper infection control measures, such as hand hygiene and the use of personal protective equipment, should be implemented in healthcare settings. Vaccination. After recovering from diphtheria, the patient should receive a full course of the diphtheria vaccine to prevent future infections. This is because having diphtheria does not provide long-lasting immunity. Prevention of diphtheria is mainly achieved through vaccination. The diphtheria tetanus pertussis, DTP, or diphtheria tetanus acellular pertussis, DTAP, vaccines are routinely administered to children as part of their immunization schedule. Booster doses are also recommended for adolescents and adults to maintain immunity.